and see their faces and choose to do better.
Well, it's the most significant advancement in the treatment of cystic fibrosis, a chronic disease that significantly shortens a person's lifespan. 13 ABC's Melissa Vage has the story.
This new drug is not a cure, but it is the most promising and significant breakthrough in the treatment of cystic fibrosis ever. It's effective in treating the majority of patients with this disease with the greatest improvement. 28-year-old April Schoen was born with cystic fibrosis. It's a genetic defect that causes mucus to build up in the lungs and the organs, and it's ultimately fatal.
I would say around 18. It just started to slowly get worse. I started to become a pre-diabetic, and now I'm full-blown diabetic.
But a year and a half ago, April started an experimental drug, and the results were dramatic.
My lungs were about like 60% functioning, and they went up to 99 in like a month.
It really takes drug therapy from the laboratory to the bedside with these patients.
ProMedica Dr. Bruce Barnett has treated cystic fibrosis patients for years and says this new drug, which is one of 3, is a game changer.
These drugs take the protein that's abnormally made in the cell and modify it so that the protein now works right.
The medication is called Trikafta. It is actually a combination of 3 drugs that have been developed over the last 10 years. Dr. Barnett's practice is one of the clinical trial sites. The trials show lung function improved just under 15%.
These kids and young adults had quality of life improvement scores of 19.5. This is dramatic.
And allows patients like April to do things she never thought she would be able to do.
I was never able to run like a full mile, and I did run my full mile after this drug, and it was just amazing.
Melissa Vage, 13 ABC Action News.
Dozens of University of Toledo medical students received extra life